For-profit health insurance companies have an incentive to treat you and me poorly. Check it out. Leave your comments, ding the bell, share it with your friends, and subscribe to our channel. It's Anything Goes Friday, but Melinda St. I mentioned earlier at the top of the show, Melinda St. Louis would be with us a little later on in the program. We had to move things around. So she's here now, and she is the campaign director with the Medicare for All campaign that is part of Public Citizen. Citizen.org is the website. Her Twitter handle is Melinda Pubcit, Pubcit, and of course, public_citizen. Melinda, welcome back to the program. It's been a while since we've talked.
Hi, it's great to be here. Thank you.
Thank you, Melinda. So I heard the president, and I thought I heard him say in his address to the nation a couple nights ago, but I certainly heard him say when he was having his little roundtable with the insurance company executives and brought the news media in, that he had directed the insurance industry, or they had volunteered, or whatever, to cover all the costs, no co-pays, no deductibles, for coronavirus testing and treatment. Is that the case? Did I hear that right?
Well, that is what did come out of his mouth, and yet that does seem to be a mischaracterization of what our for-profit insurance system is willing to do. We immediately afterward, a lobbyist from the largest health insurance lobby made clear that they had agreed to testing, but not to waive copays and deductibles for treatment, and so that was, either they were contradicting him or it was a mischaracterization, and I think it's really just lays bare just how greedy our for-profit health insurance, supposed healthcare system is, that they are continuing to make clear that they intend to profit off of coronavirus treatment in the middle of a pandemic.
Well, the distinction that I think that people who are opposed to Medicare for All keep missing, and I'm baffled as to why, particularly the Democrats who are opposed to Medicare for All keep missing this, is that the health insurance industry, to call it the health insurance industry is a misnomer. These are not people who have any credentials with regard to health. These are bankers. They're taking in enormous amounts of money. They're skimming 10, 20, 30% off the top and putting it in their own pockets. The last two CEOs of United Healthcare, the first one, Bill McGuire, took $1.6 billion in total compensation. Stephen Helmsley followed him and took, I believe it was over $800 million in compensation. These guys are getting, and there's over 100 people working at United Healthcare who make over $1 million a year. These guys are getting rich, and all they do is pay our bills. They just write checks. They're bankers. They're not health people. Or am I missing something?
That is exactly right. And in fact, their business model is to take in obviously more in premiums than they pay out in services. So there is enormous incentive to deny care in our for-profit supposed healthcare system. And what we know, what that means is that fully 1/3 of our healthcare dollars, so we spend double what most other countries, comparable countries, spend on healthcare, and our outcomes are dead last on almost every indicator. Well, that's because a fully 1/3 of what we spend goes into CEO pay, goes into profits for shareholders, etc. This is when you really think about it, the idea that anyone would earn a profit over healthcare, basic healthcare, and now laid even more bare in the context of this public health emergency is an outrage. And I think it's starting to. I think even what we're seeing is that even those who have been opposed to Medicare for All do find themselves realizing that we do need that in the context of the coronavirus, because this isn't. Healthcare should be a human right, but also if your neighbors don't have access to testing and treatment and vaccines when they become available, that means that we are in a much more dangerous position than other peer countries in being able to combat this pandemic.
Yeah, absolutely. So essentially, and this is, I think, probably the most shocking part of this, and I was surprised this morning looking at the news reporting on this, that nobody was pointing this out. Essentially what the health insurance industry just said to the American public is that, because there's very, very few people who have, no co-pays and no deductibles. There's very few. I'm guessing probably fewer than 5% of Americans have policies that have no co-pays and no deductibles. So basically what the health insurance industry said to the American public was, if you think you might have the coronavirus, and if you can't afford that $50 or $100 copay to go to the doctor to find out, or if you get sick and you actually need treatment from your physician or from a hospital, don't go, don't get treatment, don't check it out, because we're not going to cover the copays and deductibles, and you're going to have to pay for them out of pocket. And 40% of America can't handle a $400 expense. More than half of Americans can't handle a $1,000 expense. And most, the average insurance deductible, even with the Obamacare plans, is, I believe, between $3,000 and $5,000. You do this for a living. You probably know better than I do. But isn't that basically the message that they're conveying to Americans now?
Well, absolutely. I mean, we already know that already 1 in 3 adults report that they do not seek care that they need due to cost. And that's before the coronavirus. We also know that some of the early people who went to get testing got hit with surprise bills of upwards of $3,000. So that is, and the insurance company initially said that they weren't going to pay that. So everyone in the United States has a story about fighting with their insurance company. And so if you have a question and you're worried that you might end up as one of the 500,000 Americans who goes bankrupt due to medical debt, you're going to think twice, and you're not going to get the care you need, and particularly the preventative care you need or the testing that you need. And that puts us, again, at an enormous disadvantage in trying to combat something as virulent as this coronavirus pandemic. And the insurance companies just made very clear, no, we intend to continue to profit off of treatment for coronavirus.
Now, Trump also said, correct me if I'm wrong, I thought for sure he said when he was sitting there with all those insurance industry executives, no more surprise billing. They're walking that back here now, too. Did they lie to him, or did he lie to us? Do we know?
Well, with surprise billing, there are currently 10,000 Americans every day who receive a surprise bill. And just to be clear what that means, what that is people who have insurance go to an in-network hospital, they do the research, they go to a hospital that is in their network, and then there happens to be a provider at that hospital that is not covered in their network, and then they get a surprise bill for hundreds, thousands, up to tens of thousands of dollars. If you have a surgery or if you go to the emergency room, you are likely to be hit with these surprise bills. It's completely outrageous, and yet Congress hasn't even been able to close this outrageous loophole due to immense spending by private equity firms that have gotten in on the game that are actually putting providers into hospitals outside of networks, and their business model is to just surprise bill patients, and we've already seen examples of that happening for people seeking a treatment for coronavirus.
Just to clarify, it sounds to me like what you're telling me is that these private equity companies, like Mitt Romney's business model, right, that they are buying up hospitals, and now they can run these hospitals, and they're saying, somebody's going to come in for an appendectomy or for a knee replacement or whatever it may be, and they're going to call and say, does my insurance company, is your hospital in the network? We'll say yes, all's good. They come in, but we're going to put an anesthesiologist who you won't even see until you're unconscious, or we're going to put somebody that the patient's never going to interact with, or a piece of machinery or a piece of equipment into that hospital that won't be covered by the insurance company, just so we who own the hospital can send that person a $10,000 bill and increase our profits. Is that what you're saying?
Well, we're seeing that happen with with hospitals, but we also see private equity actually like running networks of providers. So actually having doctors would actually be employed by a private equity company and then work as contractors in even public hospitals and even other hospitals.
Oh my God.
And they are necessarily not in network. It's almost like boggles the mind that this can actually be happening, and yet it's happening extraordinarily common. It's very common now, and they are using and now using campaign contributions to congressional leaders. They're trying to even block even modest action, and so that's why we know we need a Medicare for All system that would provide everyone with the health care they need
all this stuff
without any
Yeah,
copay.
I'm with you.